Have you ever wondered why some women have irregular periods and how it affects their lives? A regular menstrual cycle is a complex interplay of hormones and bodily functions, occurring typically every 24 to 38 days, with the average cycle lasting around 28 days. However, some women experience irregular periods, characterized by variations in the length of the cycle and the flow of menstrual bleeding. Several factors can contribute to these irregularities. Stress, lifestyle changes, hormonal imbalances, excessive exercise, and conditions like polycystic ovary syndrome, or PCOS, and thyroid disorders can all play a part. The effects of these factors can lead to unpredictable cycle lengths, inconsistent ovulation patterns, and variations in menstrual flow. The unpredictability of irregular periods can create confusion and uncertainty, making it a challenging aspect of women's health to navigate. Now that we understand what irregular periods are, let's delve into the challenges they pose when detecting pregnancy. Detecting pregnancy can be a complex task for women with irregular periods, but why is this so? Well, this complexity arises due to several factors, all tracing back to the unpredictable nature of irregular menstrual cycles. This unpredictability can impact the accuracy of pregnancy tests and the identification of pregnancy symptoms. Firstly, let's talk about unpredictable cycle lengths. Irregular periods often come with variations in the length of the menstrual cycle. You might have cycles that are shorter than the typical 28 days, or perhaps they're significantly longer. This inconsistency makes it tough to know when to expect the next period, making it challenging to identify missed periods, a common early sign of pregnancy. Next, there's inconsistent ovulation. Irregular menstrual cycles can lead to irregular ovulation patterns. Ovulation, which is the release of an egg from the ovary, typically occurs around the middle of a regular menstrual cycle. But when periods are irregular, ovulation can be as unpredictable as a roll of the dice, making it harder to pinpoint fertile days and potential conception. The third challenge is the variation in menstrual flow. Irregular periods can involve lighter or heavier bleeding, and even spotting between periods. This variability can cause confusion about whether bleeding is due to menstruation or pregnancy-related implantation bleeding. Then we have inconsistent pregnancy symptoms. These refer to the variable presence or intensity of common early pregnancy signs in women with irregular periods. Symptoms like breast tenderness, fatigue, and nausea can be nonspecific and can overlap with symptoms of other conditions or hormonal fluctuations. Women with irregular periods may experience these symptoms at different times during their cycles, making it difficult to attribute them specifically to pregnancy. Lastly, there's the issue of delayed recognition of pregnancy. Some women with irregular periods may not realize they are pregnant until late in their pregnancies because of the challenges we've just discussed. Delayed recognition can have implications for prenatal care and decision-making. These challenges can indeed make detecting pregnancy a bit of a puzzle. But don't lose hope. So, what can women with irregular periods do to accurately detect pregnancy? This is a question that plagues many, but there are several strategies that can help. Firstly, tracking ovulation can be a powerful tool. Even though it may be irregular, ovulation can often give clues about potential pregnancy. There are many methods to track ovulation, such as monitoring basal body temperature, checking cervical mucus, or using over-the-counter ovulation predictor kits. Secondly, understanding how to use pregnancy tests appropriately is crucial. Most pregnancy tests work by detecting the presence of human chorionic gonadotropin hormone, often referred to as HCG, in a woman's urine. This hormone typically begins to rise after implantation of a fertilized egg. However, the timing of this rise can vary, especially in women with irregular periods. Therefore, taking a pregnancy test too soon after a missed period might not yield accurate results. Wait at least 1 week after the missed period to take a home pregnancy test for more reliable results. Finally, and most importantly, seeking medical advice is crucial. If you suspect you might be pregnant, it's always best to consult a healthcare professional. They can provide a blood test which is more sensitive and can detect pregnancy earlier than home tests. Additionally, they can offer guidance and support, helping you understand your unique cycle and what it might mean in terms of pregnancy. Remember, these are just tools and guidelines. None of these methods are foolproof, and they should not replace professional medical advice. So, if you're experiencing unusual symptoms or have concerns about your menstrual cycle or potential pregnancy, please reach out to a healthcare provider. Irregular periods don't have to mean a guessing game when it comes to pregnancy. With the right approach and professional advice, it's entirely possible to navigate this journey successfully. Remember, every woman's body is unique, and understanding your own can be your greatest tool. Inconsistent pregnancy symptoms. Inconsistent pregnancy symptoms refer to the variable presence or intensity of common early pregnancy signs in women with irregular periods. Pregnancy symptoms such as breast tenderness, fatigue, and nausea can be non-specific and can overlap with symptoms of other conditions or hormonal fluctuations. Women with irregular periods may experience these symptoms at different times during their cycles, making it difficult to attribute them specifically to pregnancy. Delayed recognition of pregnancy. Due to the challenges mentioned above, some women with irregular periods may not realize that they are pregnant until late in their pregnancies. Delayed recognition of pregnancy can have implications for prenatal care and decision-making. Stress and anxiety. The uncertainty surrounding irregular periods and the potential for pregnancy can lead to increased stress and anxiety, which can further disrupt the menstrual cycle and exacerbate symptoms. How to determine pregnancy with irregular periods. Monitor your menstrual cycles. Irregular periods might not follow a typical 28-day cycle, but you can still track your cycles. Keep a record of your period start dates and any notable changes or irregularities. This can help you identify patterns and notice any missed periods. Use ovulation prediction kits. Ovulation prediction kits, OPKs, can help you detect when you're about to ovulate. By identifying your fertile days, you can increase the accuracy of your timing for taking pregnancy tests. Monitoring basal body temperature, BBT. Tracking your basal body temperature can help identify when you've ovulated, which can be useful for pinpointing the timing of conception. Though there is no specific temperature to identify the pregnancy, a sustained high BBT can indicate pregnancy. Consult a healthcare provider. If you suspect you might be pregnant and experiencing irregular periods, then it is advisable to consult your healthcare provider. They can perform a blood test to measure HCG levels accurately. Pay attention to your pregnancy symptom. While pregnancy symptoms can be ambiguous and overlap with other conditions, be aware of any unusual changes in your body. Pregnancy symptoms such as breast tenderness, nausea, fatigue, and frequent urination may develop within a few weeks of conception. If you experience these symptoms along with irregular periods, it's a good idea to take a pregnancy test. Conclusion. Having irregular menstrual cycles indeed complicates the process of recognizing the pregnancy, but it's not an insurmountable challenge. By paying attention to early signs and using reliable pregnancy tests, you can confirm a pregnancy even with irregular cycles. If you suspect you might be pregnant, don't hesitate to seek medical advice and support from your doctor to ensure the health and well-being of both you and your baby. Irregular periods may present some uncertainties, but with the right care and guidance, you can navigate pregnancy successfully. Shared information provided by Dr. Yallamanchili Suneetha, consultant obstetrician and AMP gynecologist, Ankura Hospital for Women and Children.